was in medical school, it quickly became clear that ordering tests was going to be a big part of being a physician. But in psychiatry, we don't really have something like that. Historically, there's always been a movement to make psychiatry a little bit more like other fields in medicine. I'm certainly envious of my medical specialist colleagues who can order tests to help them diagnose and treat certain disorders. Which brings us to genetic testing and psychiatric medications, also commonly known as gene psych. So what is it? Well, interestingly, it turns out that the way you metabolize medications in the liver has a lot to do with your genetics. By testing for this, we can make conclusions as it relates to the metabolism of a given medication. By metabolism, I mean how well the body breaks it down. We assume if our body breaks down a medication well, perhaps we'll also have a better response to that medication. When this first came out, I was quite excited. So I ordered it and I watched my other psychiatrist colleagues order it. And this is what I observed over the years. Sometimes I followed the recommendation of the test and it worked. And sometimes I followed the recommendation of the test and it didn't work. Other times I did not follow the recommendations of the test and it worked. And sometimes I did not follow the recommendations of the test and it didn't work. For me personally, it was no better than me deciding on my own. So now I use this test in a very specific way, probably most frequently in patients that are refractory or resistant to many medications. If I find myself trying this medicine and that medicine and I can't figure out how to help somebody, then I most certainly would consider ordering this test as a way to guide me further. So I certainly like it as an option for folks who have not responded well to multiple medications. But to use it in the same way an internist would use a blood test or an x-ray or even a test for diabetes will never be a good idea. And in my opinion, is sort of like putting a square peg in a round circle. Because remember, you may be able to order an x-ray and definitively diagnose a broken bone. There's no denying it. But two people can have, say, depression and not share one symptom. So overall, I think it's a fascinating test that could be useful. We must also know its limitations.